and share my presentation. Bring it up. Ooh, can everybody see my slides and hear me?
We can, yes.
Excellent. Okay. So I am hoping to talk for around 45 minutes, and then there'll be plenty of time for questions. I can't actually see the chat or any of the questions that come in while I'm sharing the screen, so I won't be able to make any comments on things as they come in, unfortunately. I don't use Teams very often, and I don't know how to change the setup so that I can see that, but we'll have time at the end to come back to everything, hopefully.
Yeah, we will, yeah.
So I do lots of systematic review, literature searching for reviews in public health. And I have done some in sort of more clinical topics as well. And I have found that there is actually a really big difference in the approaches and the types of information that we're looking for. So I thought it would be quite useful to have a chat about that. And there has been quite a lot of papers written about doing literature searching for systematic reviews in public health. And so I just wanted to put some really practical hints and tips that I've kind of discovered on top of that literature that's been already published. So that's what I'm going to cover, and I've got sort of 5 topics that I'm going to go over. So first of all, a little bit about the London School of Hygiene and Tropical Medicine, or LSHTM for short. We really love acronyms at LSHTM. I get quite a lot of questions about how we've set it up and how it works, so I'll cover that in the beginning, and then I'll go on to actually going through a particular search that I did for a published review. And then you'll see after that why I've got a section on improving the precision of searches. Then I'll go on to an area of work that we've been looking at quite recently, which is about moving from public health to global health and how to make a search more global in its outlook. And then also about decolonising the systematic searching and how we can surface more diverse papers and more diverse authors, but also how we can encourage more diverse people to be involved in actually producing systematic reviews. So if that is okay with everyone, I will start with a bit of background about LSHTM and the Library Archives and Open Research Services, systematic review services. So this is some pictures of LSHTM. So we are a multinational institution, even though we're called the London School of Hygiene and Tropical Medicine. So the image on the top left is our main building in London. So any of you who have been to Senate House in London might recognise it because we're directly across the road from the Senate House Tower. And this building was built for LSHTM in the 1920s. So it's the Art Deco building. And this was our home in London until relatively recently. And then now we have 2 units, which are the 2 images at the bottom of the screen. The one on the left is our unit in Uganda, and the one on the right is a unit in the Gambia. And we, as a library service, provide support to the academics and the students who are working in those 2 units, as well as those who are in London. The 4th image is of our library itself. So as you can see, it's a very Art Deco very traditional looking space. It's also quite small. Those of you who are used to bigger higher education libraries, we are a postgraduate only institution, so we don't have those thousands of undergrad students. But most of our students are actually distance learning students. We only have around 1,000 to 1,500 students who come to London. Most of them are based anywhere around the world. And so a lot of the support that we provide for them is online rather than actually face-to-face physically in the building in London. And we're a specialist institution. We specialise in public health, infectious diseases. And I have to say that we won the Times Higher Library of the Year in December. We're all very chuffed about it. So I had to include a picture of us getting our award. I was actually moving house on that day, so I didn't go to the award ceremony. So you've not got a picture of me in my glad rags. A little bit about the systematic review support that we provide to our staff and our students. We try as much as possible to provide the same level of service to all of our users. However, because our students and our staff are doing systematic review projects for different purposes, we have to provide them with slightly different services. So the students are doing it as part of their assessment. And so the search strategy and the way that they put their search together is part of what they're being assessed on. So we can't do that bit for them. We provide them with training and support, but it's up to them to go and do it. With the staff, obviously, they are doing it as part of their research. Quite often it's a commissioned piece of research. And so we will provide them with that bit more support to make sure that it's done to a really high standard. So we provide press reports for our staff using the press guidance. And the only thing that we provide that people have to pay us for is if they want to subcontract a librarian to actually do the searches for them. Most of the time that's me that they're subcontracting, but depending on availability, some of my colleagues can also be involved. So it's this subcontracting bit that I get a lot of questions about. So how that tends to work is that an academic involved in the project will contact us and say that they're looking for some help. And once they've said that, yes, we have some money that we can pay for this help, I will then set up an initial free meeting with them where we can discuss the project, what the project's about, whether they've got any sort of draft protocol that we can discuss, and the sort of the parameters around it. And from there, I can put together a quote for the work. And again, we might need a little bit of toing and froing until we've got a quote that is acceptable to the team and we're clear on exactly what they're wanting me to do for the money that they're paying. We also discuss timeframes and things like that, obviously. This is the very sort of general rubric that I use to put the quote together. So we quote for the number of hours of my time. And so it obviously depends on how complicated the search is, how many databases we're searching in, whether they're wanting me to do a grey literature search or not. One thing that we've just started doing within the last 6 months is uploading the search methodology and the search strategies to Data Compass, which is our institutional data repository. We used to just do that on request, but now it's our default. Prisma S, which is the standard for systematic searching in Prisma, that is their recommended thing to do with search strategies rather than putting them as additional files on the final manuscript where they can get disassociated. from the manuscript, having them as a separate published item with a DOI that you can link to, they much prefer. So that's a change that we've just recently made. The income that we get from doing the systematic reviews, unfortunately, it doesn't go to me. It goes to the library, and the reason that we have charged for the service is actually because it's not in any of our job descriptions. So the project is basically paying the library for my time to do this. And the income is used to pay for myself and the team who are involved in the systematic reviews to go to training and things like that, and go to conferences about systematic reviews. But we also use it to pay for conservation and preservation of our special collections. And for doing the searches and writing the search methodology, etc., that is more than enough for me to be listed as an author on the manuscript and the published report. And I just wanted to show some of the papers that I've been an author on, just to illustrate some of the variety of public health reviews. So these first two are very much looking at diagnosis and the diagnostic accuracy of different types of diagnosis. So they're probably the most clinical type reviews that I get involved with. I'm quite often doing reviews which are looking at reducing the spread or the transmission of particular diseases in particular circumstances. So this one was looking at TB. And this is quite a specific one. So we're looking at a very specific disease in a very specific circumstance. But often they're much broader than that. So they're looking at a category of diseases, and they're looking at a whole spread of different interventions that we can use to try and contain those categories of diseases. They can also be quite multidisciplinary. So this one is based in schools. So for this particular review, we actually looked in, I think it was 19 different sources, because we included a lot of social science and education specific databases, as well as the medical ones. And I'm getting more and more involved with our Centre for Planetary Health, which is looking at the intersection of health and climate change, and doing a lot of stuff around that. And I've got a degree in ecology, so it's a particular interest of mine. So I'm really pleased that they've been asking me to work with them on that. But as you can see, there's a real lot of variety there. So I want to now go through sort of my step-by-step process of putting together a search on a particular topic. And I want to emphasize here that this is my process. And if you do it in a different way, that doesn't mean that I'm saying that your way is wrong. I'm just saying that this is how I do it. And hopefully you might pick up some hints and tips from me. And likewise, I'm really keen to learn from other people. There were a few names of the attendees that I recognized as people who also do lots of searching on systematic reviews. So I'm really keen to hear from you all and see if there's anything you think that I've missed, or anything you think that I do that I could streamline, or you think I shouldn't be doing. So yeah, we can have that conversation at the end. So I'm going to use this particular paper that I did the searches for. I didn't get an authorship on this one, but I did actually do their searches. And I chose this one because this is a topic that when they first approached me, I thought, oh yeah, that sounds quite easy. You know, the topics are quite well defined. You know, the vector control, okay, I've done reviews on vector control before. Malaria prevention, okay, that seems fair enough. and humanitarian emergencies. Yeah, okay, that seems doable. But then when we started talking and they sent me their draft protocol, I had a look at how they were defining what a humanitarian emergency was. So this is taken from the study protocol, which was taken from a World Health Organization definition of what a humanitarian emergency is. And I have added the bolding myself just to pull out some of these phrases. It's much wider than I had originally anticipated. So it's a calamitous situation in which the functioning of a community or society is severely disrupted. So, okay, that's quite a lot of different circumstances. It can be natural, it can be anthropogenic, and also key to this is that there can be secondary outcomes from a humanitarian emergency, which can come out of the initial disaster, where you can have further breakdown of government authority, you can have wars, you can have human rights abuses, and they were interested in these situations as well. So suddenly from thinking, oh, this is quite a small self-contained review, suddenly it's kind of exploded into this huge topic. And this is actually quite common, I've found, with the public health reviews that I get involved with. They're not small, discrete reviews looking at whether one particular treatment helps with one particular disease, for example, is quite common with clinical reviews. These are much, much broader in scope. So how do I go about trying to put together a search on a concept like humanitarian emergencies? Well, first of all, I talked to the team to see whether just putting together some quite general terms around humanitarian emergencies would be sufficient, or whether they wanted me to include all the specifics of humanitarian emergencies in the search. And when we discussed it, we agreed that actually we would have to put the specifics in, because there may well be people who have written papers about particular humanitarian emergencies where, you know, they haven't mentioned the phrase humanitarian emergency. They've talked about a particular earthquake or a particular conflict or a particular flood, and used those words rather than the more general words. So then I thought, right, okay, has somebody already put together a search on this, and I can just use their search and then obviously reference it, but that will reduce my work. I couldn't find one that I felt covered the topic in the detail that we needed. So then I was like, okay, I'm going to have to do this myself. So I did a lot of reading around the topic, trying to get a handle on what actually is encompassed within this topic of humanitarian emergencies. And I came up with a sort of high-level list of the different types of situations that we were actually interested in. And then I ran this past the rest of the team just to make sure that I'd included everything and I hadn't missed anything out, or if they wanted me to exclude some things, they said, well, actually, this isn't relevant. But this was the list that we came up with. Note that this is just a high-level list of words. So for each of these topics, I then had to go through and build up the actual search terms and come up with the synonyms and the subject headings, etc., for each of these individual bullet points. So for the sort of more general humanitarian disaster terms, again, I did a bit of reading around and came up with a few terms. And we decided that I could just use the term disaster because in the academic literature, if somebody is talking about a disaster, it tends to be this type of humanitarian emergency. It's got quite a specific meaning within academia. Likewise, humanitarian, if somebody's used that word, then it's probably going to be relevant. I don't need to qualify that anymore. We agreed that stockpiling is something that only really happens when there's some sort of emergency situation. And so if somebody is talking about that, then it may well be relevant. So I should put that in. I also found this abbreviation of CBRNE, which stands for chemical, biological, radiological, nuclear, or explosive, which is a sort of catch-all for a sort of man-made emergency. Once I've got those list of synonyms, I then put them together in Ovid SP syntax. I always trial out my searches in Ovid Medline, and that's just because it's the database system I'm most comfortable using. It's the database I'm most comfortable with. So I have a pretty good handle on how many papers I would kind of expect to retrieve on public health topics within Medline. So I can tell, oh, that doesn't quite look right when I'm putting my search together. So that's why I use Medline. Once I've put that search together, I'll then go on to the next bullet point for my list of sort of subtopics within this broader concept. And then pull it all together in one giant search. So this is the final search that I put together for that particular review. It was 143 lines long, and it found 845,000 results, which again isn't unusual for, I've found anyway, for public health reviews. What I tend to do at this point is then go back to the rest of the team and just get them to sense check it and make sure again that I haven't included anything that they say is irrelevant, make sure that I've included everything so I haven't missed anything. Oops. So that was the process for just one of the concepts. So I then went back and did that same process for the other concepts, came up with the final search. Again, we did a little bit of toing and froing just to get the numbers to a place where everybody was happy with the numbers of the amount of screening that we're going to have to do. And I'll come on to that in a moment. We ran the search across 7 databases, 3 trial registers, and we also did a grey literature search. And we had 12,500 papers to screen, and 24 were included in the review. So I wasn't involved in the screening, but my colleagues had to screen 520 papers for every one that they included. And again, that is not unusual for public health reviews. And I was at a conference where somebody presented on this, I think they called it the number needed to screen, and they found that in public health reviews that number was far higher than it was for other types of reviews. And I can't for the life of me remember who it was and what conference it was. So again, if anybody who is joined us this afternoon has any idea of what I'm talking about, if you could put the details in the Q&A or in the chat, that would be amazing, because I've been trying to find those figures and haven't been able to find them. But you can see that, we get really huge topics and really huge numbers of results. So one of the things that I spend a lot of time doing when I'm putting the searches together is looking at improving the precision of my searches. So trying to cut out the amount of noise that we retrieve. And, if you've got 3 concepts, which is quite common, and they're all really big, broad concepts like humanitarian emergencies, even when you combine those together with an and, you're going to end up with a huge number of results at the end just because the numbers that you're dealing with are so big. But if you're trying to improve precision, you don't actually need to improve the precision on all 3 of those concepts. You can just reduce the number on one of those concepts and it'll have a massive difference in the number of results that you retrieve at the end once you've ANDed everything together. And I've found that there's usually one of the concepts that is much easier to improve the precision in than others. And so that tends to be where I'll start. Quite often I've found that there'll be 2 of my concepts are really big and broad, and the third one quite often is much narrower, either because it's much easier to define, or it could be just because it's a new topic and there's not a huge amount of information written on it. And by having a third concept like that, that can also help you to reduce your numbers down a little bit. I find when I'm doing teaching with students and they've done one concept and they've ordered all their terms together and they get 3 million articles, they panic a little bit. Well, they panic a big bit actually. And just by telling them to wait until they get to the end and everything together is really useful to them. So one thing that I'm always on the lookout for when trying to increase precision is what I call ambiguous words. So the public health tends to use a lot of just general words that are used in everyday language. And so they can be used in a variety of different subject areas and topics. So I think it was a couple of weeks ago now, I was doing a search that involved us listing all different types of alcoholic beverages. So we were having great fun within my team coming up with a list of different types of alcohol. But we ended up dropping sake because it founded everything with the word steak. We dropped port because I was finding lots of things about shipping and trade. And we dropped Madeira because it was finding lots of things about the island rather than the drink. They were quite easy to spot. One that took me quite a bit of head scratching was the list of social media platforms that are shown on the screen on the slide here. We were doing a search where actually we had to include a list of different social media platforms, and we just copied and pasted it, I think, from somewhere, which is why we don't have it all each term on a different line. We had it as just one big long term. And we couldn't figure out why we were finding so many completely irrelevant studies. And then we eventually discovered that one of these social media platforms is called Medium. So our search had found everything with the word medium in it, which I'm sure you can imagine was quite a lot of papers. So we then thought, well, actually, given that this is an unusual social media platform, they are unlikely to have just used the name of the platform without qualifying that it's a social media platform. So we can remove the name and it will be picked up by other lines in our search that include things like social media. And that got rid of a lot of noise. It took us a while to spot that one. If you can't get rid of those ambiguous words, another thing that I find that's really useful is to use proximity searches. So I realize that this isn't available in every database, but I do use them quite a lot. And I do spend a bit of time trying to figure out which is the best level of proximity to use for that particular search. And this is how I do it. So this is a screenshot from an Ovid database. So I run the searches with different levels of proximity, which is lines 1 to 5. And then I have a look and see which results have been retrieved by each individual level of proximity. So line 6 shows me the papers that were only found by doing a ADJ2 rather than an ADJ1. And I'll have a look through the first 50 to 100 results and see, okay, is this finding me relevant papers here? What's the proportion of the relevant papers to the irrelevant papers? Is this worth my while keeping in? And if the answer is yes, then I'll go to the next one and say, all right, okay, for this 300 that have now been picked up by using ADJ3, what is that worth using? Is that still picking me up a big proportion of potentially relevant papers? Just looking at extreme events, not looking at any of the other content, any of the other areas of the search. And I'll keep doing that until I think actually now the proportion is flipped the other way and I'm just adding way too much noise, and it's the amount of time it would take to screen those additional papers isn't worth us potentially catching one or two extra. And this pragmatism always has to come in when you're dealing with such huge topics and such huge numbers. In databases where they automatically include stemming and lemmatization, I try as much as I can to switch it off. So this is an example from Web of Science. You can put double quote marks around any terms that don't have truncation, and that will stop the stemming and lemmatization. So in this article where we're looking for information about ethics in research, adding in the double quote marks has got rid of 1,500 papers, which, when you've got 72,000, you might think, well, actually, that's not a very high percentage, but it all makes a difference as far as I'm concerned. So I do use that. The eagle-eyed amongst you would also have noted on that Web of Science example that I don't use the topic search in Web of Science. I tend to do separate title and abstract searches. Again, because I find the topic search in Web of Science just returns so much noise in the results. A lot of people think that you can't do abstract searches in the Web of Science, but I find that even though it doesn't tell you that you can, I just tried it one day and it seems to work. So you just have to put the title search and the abstract search in separately, the same as you do for a EBSCO database. And again, for Ovid, I tend not to use the default MP or multi-purpose search. I will sometimes use title, abstract, and keywords, but to be honest, if it's a database where I'm using subject headings as well, then I tend to just rely on title and abstract, and it does reduce the numbers quite considerably. So putting all of those things together, I find really narrows down the number of results that I retrieve, and I try to improve the precision by using my search terms and the search fields rather than adding in lots of limits or lots of filters. I find that that makes it's better methodologically to make your search more precise than to just exclude lots of things. And also a lot of the limits and things aren't always available in all the databases. So actually making your search terms as precise as you can means has better results if you're searching in lots of different databases. Okay, very quickly, I want to pull back a little bit and talk more about searching in global health rather than just public health. So in that particular example of malaria control and humanitarian emergencies, that's kind of the results of that are of use to people living in countries where malaria is an issue, which is shown in this map with all the countries highlighted in red. So this map's from the World Health Organization. And so we were really keen to make sure that we found papers that had been published by researchers working in these countries, because they would have the lived experience of working and living with malaria, and are quite likely to have written some really good work on this. But unfortunately, the big medical databases that we're kind of used to, like sort of Medline and Embase and Web of Science, are not very good at indexing sources from South America and Africa and Asia. So we have to actively go and seek these out in other sources. And so at LSHTM, when we are talking to people, whether they're staff or students, about their reviews, we have a discussion about which regions of the world they're expecting to find information from and whether they are actively going to source information from those regions. And this slide just gives some of the sources that are available that pull together literature from different regions. And a lot of these are freely available, so you don't need to have subscriptions to things from your library. So for that review, we looked in Africa-wide information, which you do have to pay for, and Silo, which I think we also pay for, which comes with the Web of Science. And we searched in Global Index Medicus, which is free. And then we felt that we'd tried our best to try and source things from around the world. Of course, when you do that, the next question is about language and what happens if you find things in languages that nobody in your team can deal with. There has been some studies looking at this. So Dobresko et al. Said that actually just limiting to English makes no difference. But he was very much looking at clinical information and was put lots of qualifiers around his conclusions. And the paper by Shenderovich et al. And by Chabnat et al. Found the opposite and found that actually if you're looking at a topic that is of particular interest to people living in a country where English is not the first language, then actually you do need to search for other languages. You can't, it's not enough to limit, sorry, you can't get away with limiting just to English language only. And I did a very quick and dirty search looking in 6 different databases for information on malaria, just to see what proportion is in English. So the blue bars are the English language, the orange bars are other languages. And you can see that the big databases that we use most often, Web of Science, Medline, and Embase, actually their coverage of non-English language papers, certainly on malaria, is really poor. And you have to go to more specialist databases or databases that specialise in information from particular regions to pick up a higher proportion of that non-English language papers. And so now when we are discussing reviews with staff and with students, we also have that discussion about language, which takes me on for the last 5 minutes or so to talk about decolonising, systematic review searching. And decolonising is something that LSHTM has been putting a lot of time and effort into in the past few years. And that's gone through not just decolonising the curriculum, but also decolonising our research methods and looking at how we collaborate with our research partners around the world. And so part of that decolonising our research methods has meant us having a look at how we do our systematic searching for systematic reviews and how we teach it and what recommendations we make to people. So I've already discussed the expanding sources to make sure that we are actually sourcing things from around the world, and discussions that we've had around language. The other big area that we started talking to people about is around limits, geographical limits. So this map is from the World Bank, and it shows high, upper middle, lower middle, and low income countries. And it's quite common in global health to limit your study to low and middle income countries, which is basically everything in that map which is not red. And as you can see, that is a huge proportion of the world's population, but B, some really disparate countries. And the two papers that I've quoted there on the slide by Lenkucha and Nupane and by Khan et al. Both argue, I think, very well that this is completely ridiculous and people should not be doing this. Partly because the designator that's used to put the countries into one of these four categories is a really crude economic indicator. And so, unless you're doing a study on an equally crude economic indicator, it actually bears no resemblance to the topic that you're asking. But also that it then others these low and middle income countries and sets up this dichotomy between the high income countries and the other countries, where that dichotomy may not actually exist. And so we've started having conversations with people around why they have chosen to limit their search to, for example, low and middle income countries, and whether there's potentially a better way to limit it by geography if they want to do that. And we found that researchers are actually quite receptive to having that conversation, and it's almost become a sort of default that people do without really thinking about it. And once you actually question it and people start thinking about it, they realise that actually there is a much better way for us to do this. So, for example, I was involved in a review where we were looking at a particular infectious disease, and we decided we would limit it to the countries where that disease was endemic. And then we realised that actually quite a few of those countries were high income countries. And so if we just limited it to low and middle income countries, we would have missed information from those high income countries where it was endemic. So it actually turned out to be better in the end. And I did a bit of analysis on some reviews that I was involved with to see if this actually made any difference to the papers that were included in the review at the end. So this was only done on 10 reviews that I was involved with. So it's a very biased and very small number of reviews. So none of them used any geographical limit. So we weren't able to do any analysis on that and whether that made any difference. I was able to persuade 7 out of the 10 not to have any limit on language. But actually all of the included papers were in English anyway. There was one of the reviews where we found something in Turkish, which we were unable to translate. And so we just noted that we'd found that and it was excluded at the full text screening stage. In terms of which databases we searched in, we searched either 7, 8, or 9 databases, but 4 were included in all 10. So Medline, Embase, Global Health, and the Web of Science core content. We searched in all 10 instances. So then I was interested to see if expanding the number of sources had retrieved papers which we would otherwise not have found. And is there any papers that we only find by looking at some of these more expanded, more specialist databases? And actually the answer was no. So this is the number of unique papers we retrieved. And we found that actually Embase was the database that found where we found the most unique papers. So if we hadn't searched Embase, we wouldn't have retrieved those 25 included studies. Which I was surprised at, I have to say. So then I thought, well, okay, if we'd actually only searched in the 4 common databases and I hadn't searched 9 databases and I'd only searched those 4, so Medline, Embase, Global Health, and the Web of Science core content, how much would I actually have missed? And the answer is not a lot, 4%. So I doubled the amount of databases that we were looking in, potentially doubled the amount of screening for 4% of the included studies. So this study was too small for me to decide that we're making any changes to our recommendations. We need more work, and I'd be delighted if anybody else wanted to do this on the reviews that they were involved in. But I think it does ask some questions about systematic review methodologies and whether in our search to be as comprehensive as we can be, if we're just making reviews too complicated and too time consuming. Added to that, again, looking at this from a decolonising point of view, I did another very quick analysis and found that only 3% of systematic reviews listed in the Web of Science had an author from an institution in sub-Saharan Africa. And from talking to researchers in sub-Saharan Africa, a lot of that is due to the fact that they feel that they don't have access to sufficient resources in order to do systematic reviews. But they have access to Medline, Embase, and Global Health through a system called Hinari. So, if they are finding 96% of the included studies just from looking at that small number of reviews, then the question is, should we be maybe thinking a bit more about which sources we include in order to allow the systematic review methodology to be open to people who don't have access to rich libraries like we do. That is my leaving question for you all. I've just got a couple of pages of references, and then I think we've got about 10 minutes for questions. And I
Thank you, Jane. I am back. I am. Thanks, Jane. That was really interesting, especially the decolonising and the actual figures. That it's and searching those databases is not actually bringing, you know, an awful lot of difference back. Anyway, we've got quite a lot of questions in the Q&A, so I'm not going to waffle on when I can get it up. So the first one was wait a minute, let me let my computer catch up with my brain. So the first one was near the beginning. You said that you upload the strategies in your repository. The question is, do you upload the strategies as the same entry, or do you upload them as differently? Do you upload them all as separate entries?
No, they all go together in one big document.
Okay.
So it's just listed as search strategies for, and then the title of the paper, and then they're all just in a big, long, very
Big
long, in some
list.
instances, text document.
Okay, so that's answered that one. There was one that said, can you give any suggestions of places that you may look to find a search which may have been covered, what you're looking for? So, for example, Prospero or something like that.
To be honest, I just do a search in like Medline or something and restrict it to systematic reviews. So I'll just type in humanitarian emergencies, systematic reviews, and see what comes up, and just have a look through some of those.
Okay, yeah, that's good. And I am flying through these, sorry. There's quite a few on what sources did you use for your grey literature search? And how did you manage to limit that search?
Oh, grey literature searching is a nightmare.
Mhm, mhm.
We had, I usually have quite a big chat with the team about that to begin with, because it's such a time suck. Um, so they will usually give me a list of websites that they particularly want us to look at, because the academics are the subject specialists, so they'll say, okay, these are the particular NGOs or government organizations or whatever it is that we know are particularly active in this field. And then I will go and browse through their website, or I will do a Google search, but restrict it to their domain so that I can only find the things that are in that website. And then quite often I will do just a standard Google search using terms from the search strategy that I used in Medline. But obviously cut down. So I'll do lots of different combinations of different terms, and then look through the first 3 or 4 pages of results. I don't spend ages going through, hundreds and hundreds of results. If it doesn't come up in the first 3 or 4 pages, then I don't go any further than that. But then, I keep note of exactly what I've done so we can include that in the search strategies.
Yeah. And we've got time for one more question. Would it be okay if I sent you these questions and when you've got time, you answer them and then send them back and I can forward them on? Is that okay?
That's perfectly
Right.
okay. Yeah.
Brilliant. So the last one is just because someone wants this room.
Right.
Do you use any text mining tools to help with developing your search strategies?
No, it's something I'd be interested in looking at. We have actually just started a little group in our library looking at AI, and if there's any tools out there that we can use sort of across the whole library archive and open research services team. And so, literature searching very much will come under that. But if anybody has any suggestions,
Yeah,
then
they can put them in the chat actually, because the chat keeps going even when we leave. So if anyone's got any suggestions, please do put them in the chat. And I think the last question actually was about AI, so you'll be able to go in that a little bit more. But we're nearly at 2 o'clock. So I want to thank Jane. Absolutely brilliant. I was taking notes as you were speaking, so thank you very much. And Yeah, thank you. And I will forward the recording on. Will you send the slides also, Jane, and then I can forward those on?
Yep, not a problem.
Brilliant. Any questions, any more questions or any more comments, guys, you can put them in the chat, and I will speak to you all very soon. Thank
Thank
you.
you, everybody.
Thanks, Jane. It's been brilliant. Thank you.
Thank you. Bye-bye.
Bye.